Assalamu alaikum. Hello. Now I would like to discuss about post amputation pain. Very, very, very high yield topic. In post amputation pain, there is acute stump pain, there is ischemic pain, there is post traumatic neuroma, and there is phantom limb pain. Acute stump pain happens due to tissue and nerve injury. There is severe pain lasting 1 to 3 weeks. It happens due to tissue and nerve injury. Acute stump pain. Ischemic pain, there may be swelling, there may be skin discoloration, wound breakdown, decrease transcutaneous oxygen. Then the last these two very, very, very high yield. In post-traumatic neuroma, there is weeks to months after amputation. So it happens weeks to months after amputation. And there is focal tenderness, altered local sensation. There is tenderness and altered local sensation. And there is decreased pain with anesthetic injection. But in phantom limb pain, it occurs onset usually within 1 week. Increased risk in patients with severe acute pain and increased cramping, burning pain felt in the distal limb. So in post-traumatic neuroma, if we touch the stump, there is tenderness. But in phantom limb pain, patient feels pain on that particular area. Patient feels pain where there is nothing, like the amputated portion causing this pain, which is called phantom limb pain. Okay, we are looking this stem. The 64-year-old man comes to the office for elevation of the leg pain for evaluation of the leg pain. The patient underwent below knee amputation 3 months ago. Okay, he has been trying to be fitted uh, for a walking processes, but bearing weight on the stump has caused significant pain. The patient describes the pain the patient describes the pain as intermittent burning sensation that has improved with pain medication. So when he is trying to wear prosthesis, he starts feeling pain. And on physical examination, the amputation incision is well healed and the distal flap has no areas of blanching. There is a slight bogginess over the end of the skin flap. Gentle pressure, this one is very important. Gentle pressure over the flap reproduces pain. Gentle pressure over the flap, which radiates to the leg. So it is neuroma. When there is tenderness, gentle pressure of the leg causing the pain, gentle pressure over the flap reproducing the pain, which radiates to the leg. So it is post amputation neuroma. And in here we can give local anesthetic, can provide transient relief and confirm the diagnosis. If pain relieves with local anesthetic, then it is diagnosed. Management involve excision of the neuroma. um, TCA, anti-epileptic medication can be used for pain management. Okay, now look at this portion. Look at this question. Sorry, this one. This patient has again, there is below knee amputation 4 months ago. Below knee amputation 4 months ago. The distal stump is non-tender. In here, distal stump is non-tender to palpation or percussion. Range of motion of, and he starts feeling post-operative pain. The patient reports having severe post-operative pain and express frustration that it hasn't gone away. The pain is shooting in quality and located in the absent portion of the extremity, very, very, very high yield. It is located in the absent portion of the extremity. It is worse on urination or defecation, and it is non-tender to palpation to percussion. That is, the stump is non-tender to palpation. So it is phantom limb pain. Treatment is multimodal pain therapy, the multimodal pain regimen like pharmacotherapy, antidepressant, anti-epileptic, gabapentin can be given, NMDA receptor antagonist, ketamine, analgesic, acetaminophen, opioids, adjuvant, biofeedback, cognitive behavioral therapy, mirror therapy using a mirror to watch the reflection of the residual limb moving at the location of the absent limb. Okay, and if we read this surgery, okay, look here. Regrowth of the transected nerve fiber into the tangle mass unmyelinated nerve endings can cause post-traumatic neuroma with neuropathic pain. So post-traumatic neuroma, the previous question, it can happen due to regrowth of the transected nerve fiber into the tangled mass of the unmyelinated nerve ending. It can cause post-traumatic neuroma with neuropathic pain. And neuroma is diagnosed by giving local anesthetic injection. However, in contrast to this patient, it would be located in the distal amputation stump and by pulp and exacerbated by palpation or percussion. Okay, and surgical stump revision may be necessary for a patient whose stump fails to heal postoperatively or cannot tolerate the prosthesis due to awkward stump shape and inadequate soft tissue padding. In contrast, this patient has well healed surgical scar, so surgical stump revision is not necessary. So this is the phantom limb pain. So phantom limb pain, post-traumatic, post-amputation neuroma, acute stump pain, and the last one, ischemic pain. So this is all about post-amputation pain. Hope you enjoyed.